Hello, I'm Dr. Ira Nash. Welcome to Well Said. Every year, thousands of babies are born too soon, before their organs, especially their lungs and brains, have had the chance to fully develop. These premature births can come with serious health challenges, not only in those early fragile days, but sometimes for years to come. And while medical care for these babies has advanced in incredible ways, many questions remain about why it happens, how we can prevent it, and what the road ahead looks like for these children. Here to help us better understand the world of premature infants is Dr. Olena Predtechenska. Dr. Predtechenska is the interim chief of neonatology for Northwell Health. She is also an assistant professor of pediatrics at the Zucker School of Medicine at Hofstra, Northwell. Olena, welcome to Well Said.
Good afternoon.
Before we talk about babies who are premature, I want to establish what it means for a baby to be born on time. So how is the gestational age of a baby calculated, and when is a baby considered full term?
So gestational age is calculated in weeks since the last menstrual period. And baby is considered to be full term anywhere from 37 to up to 40 weeks. So if the baby is born at 37 weeks, that baby is considered full term.
And so is there an official definition of what it means to be premature, or is it any time before 37 weeks?
It is any time before 37 weeks, but there are different degrees of prematurity. Babies who are born anywhere from 32 to 37 weeks considered to be moderately premature. The babies who are born 28 to 32 weeks, they are severely premature. And the babies who are born less than 28 weeks, they are extreme premature. And age of viability, the minimal age that baby potentially can survive, or some babies can survive, it's about 22 to 23 weeks.
Okay, so just really a little bit more than halfway through what would be a normal pregnancy.
Yeah, that's correct.
When you are evaluating either an individual baby or looking at the kind of statistics around premature infants in general, is that timing the critical thing, or is it the baby's weight, or is it some combination of the two?
The combination of the two is really important. Saying that gestational age is more important in determining how well baby is going to be doing, because gestational age is really what determines the maturity of the organs, especially brain and lungs and things like that. Saying that, age is important too, and the babies who are small for gestational age, meaning who are underweight for age, they tend to do a little bit worse. So both factors are important, but gestational age is more.
Before we get into the premature kids, just another question about normal kids. You said underweight. What's the sort of normal weight for a full-term infant?
So I do think in grams and kilograms, and there are charts. And depends on gestational age, because full-term infant starts at 37 weeks and progresses to 41 weeks. And there are charts, and the baby can be normal weight. At 37 weeks, that weight will be different from whatever is in 40
interesting.
weeks.
So those last couple of weeks make a difference.
It does make a difference.
Yeah.
The baby gains about 30 grams per day, even in utero. So about 30 grams per day. So 37 to 40 weeks, that's 3 weeks, that's 21 days. So you can actually gain 600 grams, which is a pound and a half or so.
Yeah. Okay. Interesting. So back to the premature infants, which is your major clinical focus. How common is it for babies to be born before that 37-week mark?
It's actually quite a big problem. Worldwide, about 13 million babies are born premature. If you talk about percentages, it's anywhere from 9 to 11% of the babies are born premature. In the United States, it's about 10%. The higher proportion of the babies are born closer to term, right? Bigger proportion of the babies are born at, let's say, 34 weeks than at 28 weeks and definitely than at 25 weeks.
Has that distribution of prematurity changed over the years?
The distribution of prematurity did not change much, and actually the number of the babies who are born premature, the percentage of the babies who are born premature didn't really change much over the last period of time, over the last decade. But outcomes are better, and the number of extremely premature babies who do survive is higher.
Okay. And you mentioned some statistics about the United States versus the rest of the world. Does the United States have more of a problem with premature births, or are we kind of middle of the pack in that regard?
We're kind of middle of the pack, interestingly enough,
Yeah.
right? So there are some countries with better outcomes, smaller number of premature babies, and there are countries where there are a higher percentage, but we are somewhere in the middle.
What do we know about the causes of premature birth?
So there are several causes. There are multiple causes of premature birth. It is multifactorial, as we say. But what is known, so the history of premature birth in the past is major risk factor, probably the biggest one. Then multiple birth is multiple gestation, meaning if you carry two or more fetuses, 60% of the twins are being born prematurely, about 60%, and up to 98% of the triplets are being born prematurely. Again, not necessarily very prematurely or extremely prematurely, but prematurely. Then there are some cervical length problems. Cervical insufficiency is a big risk factor.
Meaning there's something wrong with the structure of the uterus and cervix that doesn't allow her to maintain the pregnancy till the normal end.
That's correct.
Okay.
And it's not necessarily any surgical intervention on her cervix prior to pregnancy. That actually, interestingly enough, doesn't seem to be increasing the risk of prematurity or premature birth, but some women just have problems with their cervix, and there are treatments for that, but that's a known risk factor for prematurity. Then hypertensive problems with the placenta and hypertension, that's a big risk factor for
in the mother. So if the
In
mother
the mother.
has high blood pressure, she's more likely to deliver prematurely.
Absolutely. It's actually a very big category. The placental problems tend to cause high blood pressure in the mother, and these women need to be delivered, meaning the babies need to be born in order to not to affect mother's health.
So it's not that the high blood pressure causes the prematurity, it's that high
It's
blood
a
pressure...
pregnancy causes the high blood pressure, and that needs to be treated, and the treatment for it is a delivery.
Okay.
And that's what's causing the babies to be born early.
And what about other factors like the nutritional status of the mother or certain lifestyle issues that the mother might engage in?
Nutritional status is definitely important. Diabetes and prediabetes are big risk factors for prematurity. Obesity is a very big risk factor for prematurity. Then substance use or abuse is a risk factor for prematurity, including smoking. So, yeah.
Do we know why some of these things cause an increase in prematurity? Like, why is obesity a risk factor for prematurity?
Obesity impacts health overall, and that overall impact on a woman's health leads to the prematurity and leads to the preterm labor.
And what about cigarette smoking? Why does that?
Cigarette smoking affects placenta majorly. It's kind of vascular changes, meaning changes in blood vessels in placenta caused by smoking, and active substances in smoke causes variation or changes in placenta that leads to the high blood pressure in particularly, or small placenta, poorly functioning placenta, poor growth, and preterm birth.
Yeah. So we've been talking about medical and lifestyle changes or patterns that have an impact on prematurity. What about social factors, economic factors? I mean, my understanding is that premature births are more prevalent in economically disadvantaged communities. Is that correct?
That is correct, and big part of it is access to health care. So it is important to start prenatal care early, do regular prenatal visit, have a screening for infections, because infection is also a big risk factor for prematurity, treatment for the infection, overall lifestyle modification and lifestyle changes. So basically, access to health care is very, very important.
Yeah, and it sounds like it's really about assuring the health of the mother throughout the pregnancy as a way of allowing these pregnancies
Absolutely.
to go to term.
Absolutely. Mother's health is probably the most important things to continue normal, healthy pregnancy.
Yeah. So, we've talked a lot about what causes premature births. Let's change our focus a little bit to the consequences of premature birth. So what are the biggest challenges that a normal newborn faces, and how are those different for a newborn who's, ahead of schedule?
All right. So the normal newborn are usually pretty well adjusted to life outside of the mother. They adjust normally. They breathe normally. They're able to maintain their blood sugar. They're able to maintain their temperature. They do cause a lot of kind of anxiety
Yes.
and problems for the parents, but overall they're pretty resilient and do pretty well. Premature babies, though, they are definitely more fragile. And again, depends on how premature the baby is.
Sure.
Starting with late premature babies, so their issues, they might have some breathing issues. They're less common than the babies who are born a lot earlier. But we do need to make sure that they're able to maintain their temperature, that they're able to maintain their blood sugar, they're able to eat well by mouth and take appropriate amount of milk. So those are issues that we're looking for and making sure they are appropriate in a late preterm babies. The babies who are born even earlier, here you start getting the problems with ability to breathe. So, for example, I would say pretty much universally all the babies who are born, let's say, less than 30 weeks, they need some help with the breathing. And that help might be in a form of non-invasive support or even intubation, where the baby needs to be placed on a ventilator to breathe. We also need to watch their brain, because the very premature baby, extremely premature babies, are at risk of intracranial, intraventricular hemorrhage, median bleeding inside of the structure of the brain. We need to watch their eyes. We need to watch their intestine and how they're feeding. So babies who are born very, very early usually are not able to eat enterally, meaning by mouth, from the get-go. We give them nutrition straight to the bloodstream. We introduce and advance milk slowly and gradually. And again, they cannot suck yet. They cannot suck yet from the bottle, so we have to give them a tube and give them their nutrition through the tube.
Okay, wow. So that's a lot of different things that you just mentioned. I want to kind of break that down a little bit
Absolutely.
and talk about some of these. So let's talk about the breathing first. You said that that's almost predictable based on gestational age, whether neonates, newborns are going to have trouble breathing. What's that about? Is that the lungs aren't mature, or they're not physically strong enough to expand their chest? Combination of the two? What's going on?
Of all of the above and more.
Okay.
So the lungs are definitely not formed fully, right? So the structure of the lung is simpler. They don't have enough blood vessels in the lungs. They don't have enough breathing sacs in the lungs. Then they're also missing the substance that full-term babies have, and you and I have, and it's called surfactant. It really is important for proper lung functioning. So the premature babies, the more premature they are, the less that substance they have. And also, as you pointed out, the chest wall is soft and pliable, and it's hard for them to generate pressure or efforts to breathe appropriately.
Yeah. And say more about the vulnerability or the underdeveloped nature of the brain of a premature baby.
The brain has all the major structures. They form early, but it's functionally not quite normal. And we know that the brain is a developing structure. We can see it in the baby after the baby is born, right? So the babies, when they're just born, they're learning how to eat, then they're learning how to smile, then they're learning how to crawl and sit.
Yeah.
So the brain is developing. Same concept is in premature baby. The brain is underdeveloped, and it's very important for the premature baby to have that brain continue to develop normally and uninterrupted. Also, there is a structure inside of the brain which called ventricle. That's a structure which has it has fluid, right? So, and on the bottom of that ventricle, there is a highly vascular, meaning it looks like a mesh of tiny tubules filled with blood. And this structure is supposed to disappear. This normally disappears after 32 weeks. But in premature babies, it's present and prominent. And that structure it is not uncommon to have a bleeding from that mesh of capillaries, of the small, tiny blood vessels, and this is called intraventricular hemorrhage. We monitor for that, and we do head ultrasounds. This is a study to see whether or not there is a bleeding there or not.
Yeah. When you're talking about the maturing of these various organs, and correct me if you think this is a bad analogy, but I was thinking about ripe and unripe fruit.
That's correct.
and if you bring home a green banana and you let it sit on the counter, it ripens into what looks like a ripe banana. But I always wonder if that's the same banana you would have gotten if you left it on the tree until it turned yellow. And so my question for you is, when these babies mature or their organs more fully develop after birth, is that a different process than what would have happened if they were still in their mother's uterus?
It's a great analogy. And going back to the banana, sometimes you leave it kind of ripen on the counter, and it ripens in a perfectly fine yellow banana, which is great and tastes great, looks great, and it's absolutely the same. But sometimes, unfortunately, things do not go right, and you do get banana which is either continue to be underripened or has some issues. Does not look great.
If we switch back to the human part of that analogy.
Let's do that. I like that better, yes.
Yeah, since neither of us is an expert in bananas. So it sounds like a lot of what you're doing is monitoring these babies to see if they are maturing properly. Is that correct?
Sometimes it's just monitoring, and sometimes that's helping them to do that, right? So supporting them, supporting their breathing, supporting their heart health, supporting their brain health, keeping the environment appropriate, keeping their nutrition great. Nutrition is very important in the babies, because that's what promotes normal growth and development, all our organs, not just muscles and fat and bones and things like that, but also brain and lungs and intestine and the heart, whatever, all organs are very dependent on baby's nutrition. That's why there is a lot of focus on nutrition of premature babies.
And so what does that actually look like? You spend a lot of time in the intensive care unit for these tiny little babies. Paint a picture for us. What is actually going on? I mean, they're kept at the right temperature and so paint a picture of what that support looks like.
Right. So if we are talking about very premature baby or extremely premature baby, that baby will be in a heated box, which called incubator, which has appropriate humidity and appropriate temperature. We also have controlled light condition. We turn the lights on certain times of the day and try to keep dark on certain times of the day. They also host it in a kind of devices that promote normal position and positioning devices, and so they feel like they're still in utero, where with their leg flexed and arms flexed,
so
and
they're
tucked
kind of
together,
bundled up a little bit.
Bundled up a little bit in a special positioning devices. They may or may not to be on a breathing help machine, and as I said, it can range from a ventilator to non-invasive support, something that we call CPAP. And they are frequently getting their nutrition. Initially, as I said, they're getting their nutrition straight to the bloodstream, and it can be the central line or the line through the belly button or regular IV. And then we slowly introduced milk, and the mother's milk is absolutely best milk for the babies, and we give them a little bit of it, and the next day we'll give a little bit more, and the next day we'll give a little bit more, and we keep doing that until they reach their target. And then it's a moving target, because baby is growing and target is changing, so we'll be increasing the amount of milk pretty much every day, every other day. As I said, the breast milk is absolutely the best source of nutrition for premature babies. That's why we always encourage mothers to give us their breast milk to pump. We have great lactation support in the hospital where we work with the mothers and teach them how to pump and help them to achieve their goals. Sometimes we need to add fortification to the milk, so meaning some extra nutrients to it for the baby to grow properly, and it can be extra protein, extra calcium, extra calories, things like that. Majority of the premature babies do get that. So that's how the life of premature baby looks like.
Yeah, and so you mentioned a couple of things. It sounds like it's a lot of supportive care and trying to reproduce in some ways the environment that the baby would otherwise have been in inside the mother. And you're trying to allow the sort of normal development of organs. What are some of the things that can cause particular problems early in life? You mentioned bleeding into the head. What other things?
Unfortunately, premature babies are very vulnerable, and they are high risk of infection in particular. They are high risk of the condition which is an intestinal disease called necrotizing enterocolitis, which is common in the babies, unfortunately, and can be devastating. We try to prevent that by advancing feeding slowly and watching feeding tolerance pretty closely. The bleeding in the brain is another big problem that premature babies can occur. Also, eye development needs to be monitored because eyes also development of the eyes may not go properly, and the retina, the back of the eye, has some potential issues with development outside of the mother as well.
As you've been part of this developing field of taking care of these incredibly young, incredibly vulnerable patients, what have been some of the major advances that have made it possible for these kids to survive?
As I said, many advances has been happening. We do have better technologies, we have better ventilator machines. All pregnant women, if they are at risk of preterm labor, they are getting steroid shot, the medication that speed up the lung development and make babies overall more stable, so that helps a lot. Then there is a surfactant, the substance that I was talking about when I was talking about difficulties breathing. So it is a lot of advances in this. So the babies are getting surfactant. In the past, they could get surfactant only through the intubation, putting the sick tube down the throat, and now we're giving it a different way, is less invasive way through the thinner tube, and we're just dripping it, and we're not putting the baby on ventilator for that. There is also infection prevention is really a lot of advances in infection prevention and making babies less prone to that. So overall, many good things are happening.
Yeah, and so it sounds like you're doing a lot of supportive care, preventive kinds of things. If a kid makes it through this stage of life without one of those major complications like a big infection or a brain bleed or something like that, if it's just the prematurity and they make it through that early phase, are there any long-term consequences, or do these kids end up developing normally?
There are. So there are definitely issues that we need to be watching for, and those are usually with their neurodevelopment, right, with the way they function. The premature babies are at high risk of cerebral palsy. The premature babies are at high risk of major neurodevelopmental problems with their vision, with their hearing, and things like that. Saying that, majority of them do not develop severe problem, but they do have some milder or functional problem with learning disabilities, maybe attention deficit disorders and things like that. It's not every premature baby develops that, but definitely premature babies at higher risk of having these issues.
Yeah. So where do you think this field is going?
Oh, this is very young and developing field. There are lots of advances recently, and there are more great advances to come. As I said, lots of great research, probably the most prolific research area, definitely in pediatrics, if not in entire medicine.
Yeah.
A lot of efforts contributed to making sure these babies do well and have a good life.
Yeah. I'm tempted to leave it there, but I know that you and I have spoken about this before. You mentioned it earlier, that the real goal here is to not have premature babies.
Absolutely.
Right?
That is very important, right?
Yeah. Okay. So better maternal care.
Better maternal care, early access to prenatal care, regular prenatal care, screening for infection, treating of infections, lifestyle modifications, healthy nutrition, cessation of smoking, avoidance of substance use and abuse. All these things should help.
Okay. Well, Olena, thank you so much for joining us today.
Absolutely. Thank you.
Thanks also
Thank you,
to
Ira.
our editor, Edward Lee, our producer, Connor Pilkington, and our audio engineer, John Mullen. For more information about this program and to find all of our past episodes, please visit our website at medicine.hofstra.edu/wellsaid. You can also subscribe to our free podcast wherever you get your podcasts. Our listeners are also welcome to send their comments, suggestions, and questions to wellsaid@hofstra.edu. Until next time, I'm Dr. Ira Nash, and that's Well Said.